Hello, everyone. My name is Paula Neves, and I'm the lead for the Center for Living Organ Donation. I'd like to welcome you to today's webinar on transplant pharmacy. We know that this is a topic that many of you have asked for and have many questions about. And so we're very, very pleased to have with us a great speaker with a lot of experience in this area to be able to take us through your questions and the very important information that you must know as you receive your transplant and manage medications. So a reminder that we will be addressing questions at the end. You may submit questions via slido.com, and the code is pharmacy. So as we go through the presentation, please submit your questions via slido.com, code pharmacy. And I'd like to now welcome our speaker, Dipika Munial, who's a clinical pharmacist at the Ajmera Transplant Center at UHN. Dipika has been at UHN for the past 15 years. She's also a graduate of the Leslie Dan Faculty of Pharmacy and continues to be involved with the faculty as a preceptor, and is also a support to pharmacy residents at the Ajmera Transplant Center. So without further ado, I'd like to invite Dipika Munial to take us through today's presentation. Dipika?
Hi, thanks, Paula, for that. I'm really happy to be here today to talk to you all about a topic that is very important for all of us to learn about and to help navigate through the medications that you're going to receive after you receive your transplant, and how to pay for these medications or what drug coverage mechanisms are in place. Next slide. I'll go through what we do as transplant pharmacists on the MOT, on the multi-organ transplant unit. I'll talk to you about what immunosuppressants are and what the goals of these medications are. I'll talk about what a typical regimen is after transplant and how we will educate you on the floor. We'll talk a little bit about medication adherence and why it's important. And then we'll delve into some cost and coverage concerns or information about cost and coverage. And then I'll introduce you to our transplant pharmacy that we have in our Ajmera Transplant Center. And then I'll give you a chance to ask any questions if there's anything that I can further help you with, or if there's something that I didn't address in the talk already. So I'm one of your pharmacists that you're going to meet on the transplant unit. I am one of 9 pharmacists. What we do as a group is we participate in the promotion of safe drug distribution to make sure that you get the correct medication for you, the safest medication for you. We will educate you, and we educate other healthcare providers that we work with on medications, on drug interactions, on safe use of different drug regimens. We all participate in different forms of clinical research. And an important thing that we do while you're an inpatient is we will follow your drug level. So this is called therapeutic drug monitoring. So we'll look at levels of your anti-rejection medications, or maybe levels of other medications that you're on, perhaps blood thinners, or perhaps anti-seizure medications, to give you a couple examples. So the first meeting that you'll have with us is we're going to meet with you, and we're going to conduct something that we call a best possible medication history. And this is abbreviated as to BPMH, that you might hear people refer to it as. So what we'll do is we'll ask you, and maybe you'll be with your caregiver, we'll ask you what medications you are currently on. So what you're taking at home prior to this transplant admission. We'll ask you about allergies, and not only what you're allergic to, but what your reaction was to that allergy that you have. We will look at the medications that you're on, and we'll scan for potential drug interactions with the regimen we know that you're going to most likely be on. And we will, at this point, start the wheels turning in our head to determine what medications that we are going to continue, that you're taking at home, that will continue during your hospital admission, before your transplant, then after your transplant, and which medications that we want to continue for your discharge home. So again, this has a fancy term. It's called admission, transfer, and discharge medication reconciliation, or MedRec, you'll hear people say as well. At this point, while we're conducting your BPMH, or your medication history, we are going to ask you about the current drug coverage that you have, or how you manage to pay for the medications that you currently have, and if you have explored medication coverage for after the transplant. And also, while we're conducting this medication history with you, it gives us an idea of whether we need to identify additional supports to help you with medication, taking your medications after transplant, or if you need extra help or extra maybe tools to help you understand your new medication regimen. So let's switch gears and talk about immunosuppressants. So immuno means your body's immune system. Your body's immune system is your body's natural defense mechanism against those things that your body sees as foreign or harmful. And suppressant means an agent that reduces the intensity. So we're giving you immunosuppressants, which are medications that decrease the intensity or the strength of your immune system. We're not wiping out your immune system. We're just decreasing the intensity at which it is active, if that makes any sense. Synonyms for immune suppressants also are, we also refer to them as anti-rejection medications or anti-rejection agents. The goal of you taking immunosuppressants is to prevent rejection of your newly transplanted organ, to minimize drug toxicity and side effects of these immunosuppressants, to minimize the risk of infections. Ideally, what we want to do is use the fewest number of drugs at the lowest possible doses that would be effective for both your survival and graft survival, and to make sure that we're improving and maintaining your quality of life. So here is kind of representation of a typical post-transplant medication regimen. These are medications to prevent rejection or to prevent your body from attacking your newly transplanted graft. So you will be prescribed a medication, most probably in the first box, either tacrolimus, immediate release, which the brand name is called Prograf, and this medication is taken twice daily. Or you might be prescribed a medication called tacrolimus extended release, which is Advigraf, and that's a once-a-day medication. Or you might be prescribed a medication called cyclosporin, and the brand name of cyclosporin that we use is Neoral, and that medication is dosed twice daily. Then if you go to the next box or the next rectangle, you'll all be prescribed a medication called prednisone, which is a steroid, and that medication is dosed once daily in the morning. And then some of you, not all of you, will be prescribed a medication in this third rectangle, either mycophenolate sodium, the brand name of which is called Myfortic that we use, and that's dosed twice daily, or mycophenolate mofetil, the brand name of which is called Celcept, and that's again dosed twice daily. Or lastly, you could be prescribed a medication called azathioprine or Imuran, and that's dosed once a day. We're also going to prescribe for you medications to prevent certain types of infections. We call these to prevent opportunistic infections. You would be on a medication in the first group to prevent a certain kind of pneumonia. And that medication could be called Septra or trimethoprim sulfamethoxazole. And depending on the organ that you receive or your certain risk factors, you would be on this medication once a day or 3 times a week. Or you might be on something called Dapsone once a day, or maybe just 5 times a week. or you could be on a medication called atovaquone or Mepron, which is dosed once a day. To prevent oral thrush, we'll have all of you patients be on kind of a liquid suspension medication that you swish and swallow in the mouth about 4 times daily after meals and at bedtime, and that's called nystatin, and that's to prevent against a fungus overgrowth in the mouth. And lastly, in the last category, some of you might be prescribed an antiviral medication called valganciclovir or Valsite that you would be taking once a day. In addition to those medications that I talked about to prevent against rejection and to prevent against certain types of infections, there might be some auxiliary medications or supportive medications that you may need. For example, some of you may need medications to control blood pressure or blood sugar, medications to prevent acidity or peptic ulcers. And perhaps you need to go on certain supplements to replenish or maintain physiologic levels, like a magnesium supplement or calcium supplement or a vitamin D supplement. Sometimes, you will be in pain after the surgery. So we will prescribe for you pain medications, and then medications to help you prevent constipation. And then we will also, when we met with you, when we did that best possible medication history, at this point, we'll determine what medications that you need to continue to be on after your transplant. I just want to quickly touch upon this. There is a lack of safety and efficacy data that exists right now on the use of certain natural health products. So we have a statement at the Edgemere Transplant Center that we recommend that you avoid natural health products with a few certain exceptions, provided that they're used or prescribed by our transplant team. So certain vitamins and minerals are okay to use, omega-3 supplements that a lot of patients use for heart health, glucosamine products that people will use to prevent against or to help with the pain of osteoarthritis. And there are culinary herbs, so herbs that you're using in cooking or flavoring are okay. And the amount of probiotics in kind of regular yogurt is okay, but we don't recommend that you take probiotic supplements on top of this at this time. While you are in hospital after your transplant, we will take the opportunity to provide you and your caregivers hands-on a one-on-one teaching session with one of us, your transplant pharmacists. So again, your support person or caregiver is welcome to attend the teaching session. We will teach you about why you're on a certain medication, how to dose it, what side effects that you should be looking out for while you're on these immune suppressants. We'll provide for you a workbook or little do-a-tang that has all the information that we're going to talk about, and some kind of blank sheets to help you record doses. Because what we'd like you to do is, after we teach with you, is to practice taking these immune suppressants on your own under the supervision of the nurse. So we give you a little booklet to write down the doses that you take and the times that you're taking the medication, and the nurse will check your dose to make sure that you're taking the appropriate dose. So one tip I have is make sure you bring your reading glasses to hospital if you need them, because that's sometimes a barrier. Patients are like, I'd really like to participate and to help read my doses, but I can't, I don't have my glasses. So please bring your glasses to hospital. And for those of you who would like to take a look at our teaching and what we're going to teach you about, we have a website called TMIT. So it stands for the Transplant Medication Information Teaching Tool, and it's a great resource to teach you about each medication that you're on and how to take the medication, when to take them, and it goes through modules. I think on the next slide, it shows you a screenshot of what that website looks like. So on the course menu, you can click on the medication that you're prescribed, and it tells you, it goes through step by step what the medication is, how to take it, how to dose it, how to recognize for signs and symptoms of side effects, I should say. So hopefully you find this really helpful. We developed it in-house. Let's talk about adherence. This is really important. So adherence is the term that we use to describe the extent to which a patient takes medications as prescribed by their healthcare provider. This includes taking the correct medication at the correct dose and time and at the correct number of times per day. Taking your medication correctly and consistently is super important. Skipping doses or stopping to take immunosuppressants will allow your body's immune system to start to attack your transplanted organ. Over time, this causes small injuries and this can build up and cause organ damage. So this is something we want to make sure that everybody understands, that it's really, really important to take your medications correctly. There are certain things that I can recommend as adherence aids. So number one is be informed. I think there's a lot more buy-in from a patient if you understand why you're taking a certain medication and what it's used for versus just taking it because you were told to take it. I'm a big advocate for patient empowerment, if that makes any sense. I think it's important to keep with you on your person an accurate medication list of what you're on, and I can give you some tips on how to have a good medication list on your person. Have a simplified regimen. So really, we can work with us, the pharmacist team, on having a regimen that is simple and easy to adhere to instead of taking medications at multiple times of the day. Maybe we can help you group medications together that don't interact or that jive together to take at the same time. So maybe taking medications twice a day or maximum 3 times a day is much easier than splitting them up. A lot of patients, I meet them and they're taking medications 4 or 5 times a day, and it's so cumbersome, and it's really easy to forget doses if they've got so many times in the day where you have to stop what you're doing and to take pills. I think it's a good idea to keep a journal, and perhaps in your journal you can keep a record of doses that you're on or days in which you have certain appointments and doses are changed or adjusted or medication started or stopped. Set alarms. So either on everybody today has a smartphone or smart watches. You can set alarm on your watches or an old-fashioned alarm clock at home, or to make sure that you're taking your medications at the appropriate times. There are so many apps available now on smartphones that help you with, medication scheduling or giving you reminders to take your medications. Using a dosette or once a week, maybe packing your medications in a pill box might help you. Get a caregiver to help check to make sure that you haven't missed any doses. And we also have at our pharmacy, or any pharmacy actually, not just at our transplant pharmacy, if you find that your pill burden is too much or you're just having a hard time keeping on top of things, you can always ask for your medications to come to you in a blister pack. On our, I've put a link here on this slide. You can access this link for tips in our patient toolbox. So it's under our transplant pharmacy website. You can look for tips to help you with medication adherence. Here is a sample medication list that you will go home with after your transplant, your discharge from hospital after your transplant. So in the first column on the list, you'll see whether, for this particular patient, when I was making this list, I was able to indicate for the patient whether it's a new medication started this admission, or you can see it's a changed dose from home. So perhaps this patient was on this medication at home, but the dose, however, changed. Or you can see there are some at the bottom of the page that say no change. So that means the patient was on this medication prior to transplant and there's no change. They're going to continue taking this medication after their discharge home. Let's talk about medication cost and coverage. So a vast majority of us living and working here in Ontario may have drug coverage through the Ontario government, and that's called ODB, or Ontario Drug Government. And under the ODB program, there are different kind of groupings. So maybe you are enrolled in ODSP, or that's the Ontario Disability Support Program. Maybe you're enrolled in Ontario Works, or maybe you are enrolled in the Trillium Drug Program, or maybe you're over the age of 65. So all of you in this group, your medications will be prescribed under a certain formulary managed by the Ontario drug government. So any medication, I said drug government, Ontario drug coverage, any medication that is prescribed for you that falls under that formulary will be covered or is a benefit for you. Other patients may have a private drug plan. So this would be a plan that's from maybe a plan that you pay into privately, or a plan that is provided to you that you contribute to through your employer. So examples like this would be Sun Life or Green Shield or Express. I don't even know the names of all the plans, but there are many of them. Sun Life and Green Shield are one of the most common that are two of the most common that we encounter. So for patients who have private drug coverage, some of these transplant medications that you're on may need prior approval. So that means maybe your drug plan needs to authorize the use of these medications because they are quite costly. So you can get a list from us on this link that I provided here on this slide. And you can submit this list to your private drug plan to see which medications they cover. You still will, even if you do have private drug coverage or Ontario drug benefit coverage, you still might be responsible to pay for medications that aren't covered by your drug, by either drug plan, or maybe certain deductibles that you will have to pay. We can help you navigate through this. We do have a medication reimbursement specialist as part of our transplant pharmacy team that can help you manage this and can work through certain deductibles or how to enroll if you're not already enrolled in the Trillium Drug Program, which I recommend for everybody to be enrolled in, regardless of whether you have private drug coverage or not. I think it's really important that you are enrolled in the Trillium Drug Program. I believe that it is a part of listing criteria to make sure that you do have some sort of drug coverage or a plan in place. People always ask, how much do these medications cost? So I asked, just for a rough estimate, I asked our pharmacy for some cost kind of estimates. So for a month, if say you're a donor and you're considering donating a part of your liver, for instance, a month worth of medications might cost about $450. And for the average liver transplant recipient per se, drug coverage per month may range anywhere between $1,500 to $2,500 a month, depending on what your exact regimen is. We do have, I've made mention of this pharmacy a couple times. We do have a pharmacy located on the 12th floor in our transplant center called the Transplant Outpatient Pharmacy, and we lovingly have abbreviated that to TOP. They will provide for you customized pharmacy services. We have, staff that is very versed and is comfortable working with the transplant population, and they work together with your transplant healthcare team. They're located in the clinic area on the 12th floor. I think they have a very easy automated way to refill medications. That our reimbursement specialist works with this pharmacy to help you get the best of what am I saying? The best bang for your buck in terms of drug coverage and reimbursement. They do provide free delivery anywhere in Ontario. And what is really special too is that a portion of the proceeds earned from the pharmacy goes back to our MOT program, which is great. I think that's all I have planned to talk to you guys about today, but I'm super happy to entertain any questions you may have.
Thank you very much, Dipika. So I would like to now invite our our audience to submit questions. Go to slido.com, and the code is pharmacy. You'll see on screen some of the questions that we've received through the registration process for this session. So Dipika, maybe we can go through these and just review some of the content that you went over just now. So our first question talks about a lot of them asks about the medications that are required to prevent rejection. You went through those, but could you review them again, just in summary form?
So our goal with these medications that we're going to prescribe for you, the immunosuppressants, is to prevent rejection, as you've noted in your question. We want to use a kind of a cocktail of medications that work together, so we can minimize using high doses of just one medication. So we can use kind of doses of all of them that work together, so that the dose is not too high that you'd experience side effects. So we kind of use a cocktail that works together really well to decrease your body making certain immune cells or T cells, or to activate more T cells to contribute to that process called rejection. They work together. Steroids that I alluded to, a steroid that you'd be on, say prednisone, that helps working with other medications called calcineurin inhibitors or tacrolimus or cyclosporin. Steroids decrease inflammation. It works together to kind of decrease that immune cascade to prevent damage or attack of the transplanted graft.
And these medications are life-saving, and it is important for patients to take them. Can you talk a little bit about that, how life-saving they are?
Yeah. So over time, if you ask a lot of questions, patients will ask in hospital, like, what happens if I miss a dose? And I always say, well, you're not going to miss a dose, because I'm telling you, you're not going to miss a dose. But we know life happens, and sometimes you're late on a medication, or you forget to take medications that day. So we'll give you strategies on what to do depending on what time of the day that you recommend, that you realize that you've missed your dose. But over time, missing doses or not being adherent with your medications, damage builds up in your organ, and over time you'll get a decline in the function of that organ, and that is not what we want. Over time, chronic rejection occurs, and it's a process that is slow, but taking medications on time as prescribed, the way they're supposed to, greatly decreases that risk of rejection. Having every time that you get admitted for rejection in hospital, and it happens, certain circumstances happen in people's lives, that maybe they get sick or there's something going on, that perhaps they've missed subsequent doses in a row, and patients do get readmitted to hospital, and we have to administer to them high dose, potent, maybe IV anti-rejection. And avoiding a hospitalization, avoiding rejection episodes is what we want to do for you. So it's super important that you adhere to your regimen. And I sound like a broken record.
Thank you, Dipika. Another theme in our questions relates to payment for these medications, the cost of medications. You reviewed some of the sources of coverage, and you also reviewed some of the costs. Now, just to clarify, the numbers that we put up on one of the slides, are those out of pocket costs for a donor or a patient, or are those total costs, part of which could be covered?
100%. So what I did was I just asked them to give me a cost of someone who is showing up with cash and how much that would be. So depending on your drug plan, if you have 80% drug coverage, then that cost, you would only be responsible for 20% of that drug coverage. If you had 0% drug coverage, then you would be responsible for that whole cost. If you had 100% drug coverage, then that number is down to 0. But drug coverage is something that is super important for all of us to have. Living in Ontario, if you have a valid OHIP number, all of us are eligible to apply to the Trillium Drug Program. I think it's important, no matter how much money you make or how savvy and great your drug plan is, because you never know, circumstances happen. We didn't predict a pandemic happening. We didn't predict that so many people would lose their jobs in this era. So I think having the Trillium Drug Program or Trillium Drug coverage in place is a very good cushion or backup plan for all of us, no matter what your income is, because circumstances change. Now, we do have a medication reimbursement specialist that can, and social workers that can help you navigate through this process if you need help. But the one thing that is required, that if you're going to apply for the Trillium Drug Program, is that you have your taxes up to date, your tax returns up to date. So I'll give you that little hint. So if you don't get it done quickly, and then once that's done, I think the application is very easy to complete.
Great, thank you. We now have a question about sunscreen. Any particular types, brands, etc., coverage for sunscreen that you would recommend?
So
because I guess some of these medications make patients more susceptible.
You got it. Skin cancer is something that we want to avoid 100%. So we recommend that you wear an SPF of 30 or higher. And that's the only recommendation that I have. I don't have a recommendation on a type or a brand, as long as it's SPF of 30 or higher. And cosmetically, as long as you feel that it's comfortable to wear on your skin. So look for a brand that that you're a brand, or maybe what's the word I'm looking for? A formulation that you will actually wear, that you don't find too greasy or has a smell that you don't like, because if you don't like the way that it feels or smells, you're not going to wear it. So that's the only recommendation that I would have.
Mm-hmm. Yeah, absolutely. And there's also, do you recommend reapplying sunscreen? Any recommendations related to?
Yes, sorry, Paula, it's the delay, I'm cutting you off. I think you would reapply just as depending on the SPF. So depending on what the SPF number is, it recommends how many minutes that you need to reapply in a day. And then of course, if you're excessively sweating or maybe swimming, or you'd have to reapply often in that realm.
Great, thank you. Our next question is related to patients who travel in from outside of the GTA. UHN Transplant, the Ajmera Transplant Center, receives patients from across Canada, many patients from Manitoba, transplant patients from Manitoba, from the East Coast, from elsewhere. So can you talk a little bit about how transplant pharmacy works with those patients?
So inpatient, our transplant pharmacy team, we take care of all patients, regardless of where you come from, whether you're from Manitoba or Ontario or Newfoundland, you're all our patients. In terms of medication cost and coverage, it's different for patients that come from different provinces. So I talked about kind of the mechanisms that we have for Ontario. So Trillium Drug Program, Ontario Benefit, ODB, Ontario Drug Benefit. But if you are coming from out of province, it's really important at the time of your listing or consideration for transplant, that your province works with the transplant team to see what checks and balances are there, or what is required. So for instance, I was actually this morning working on some patients that have come from Manitoba for liver transplant. And part of we recognize what Manitoba needs in terms of prior authorization, or they call it EDS, exceptional drug status, for certain medications. And we have this paperwork, and we'll apply to the government of Manitoba and send the paperwork off so that these patients from Manitoba have their medications covered to be filled. It's different for each province, and every province we do have a working relationship with. But I think what the message that I'm trying to relay is that it's important that your province knows that you're coming to Ontario to get the transplant, and that you may or may not need to fill prescriptions in Ontario, because some provinces, for example, Manitoba, that I just talked about, requires that if you do fill your medications out of Manitoba, that you have to pay for them up front. And then on return to Manitoba, you would be reimbursed for those medications, as long as all the necessary paperwork is done, which is part of our job, is to get all that paperwork done and to make sure that all the necessary forms are filled out. So there are different mechanisms for all provinces. I believe Quebec patients, they have an agreement that our transplant program has an agreement with the Quebec government that all medications will be covered for them if filled in Ontario. So it really depends on the reciprocal, we call it reciprocal billing. It really depends on the agreement that's made between that province and our transplant program.
And Dipika, you also mentioned that there's a reimbursement specialist who can work with patients. And can that person work with patients before they come to Ontario, or how does that process work? Yeah,
I think that's preferred, because when you are here during your transplant admission, all we want you to do is heal and to get better and to get that organ working. Now's not the time to do paperwork or to work on your taxes or to fill out copious amounts of forms. So if all this can get done prior to you coming to Ontario, or even, over Zoom like we're doing now, or via email or over the phone, I think that's the best case scenario. So yes, we can work with you before you arrive.
Great, thank you. The next question relates to living donors. Now, you mentioned that living donors may have medications post-surgery. Could you talk a little bit about what those medications are and whether they have to take these for life?
For sure. So we prescribe, say for living donors who are donating a kidney. So those patients are prescribed upon discharge home a pain medication and something to help their bowels move, because pain medications can be constipating, especially if they have what we call an opioid or narcotic ingredient in them to help control pain. You're not on these for life, because your pain will get better and you will heal. So you're not on these medications for life. For living donors that are donating a part of their liver, we tend to prescribe more medications. The most important one would be a blood thinner to prevent the formation of a blood clot. And you'll be on this medication for 5 weeks. So again, not forever, just in that post kind of donation period where we want to make sure that the development of a clot doesn't occur. Because you're on a blood thinner, we give you some other medications to protect your tummy against acidity. We will prescribe for you, again, painkillers and some medications to make sure that your bowels are regular. And because we want to make sure that we're replenishing the goodness that's lost if there's any blood loss. So maybe some iron and some folic acid. Again, not forever, just for a little bit after transplant donation.
Thank you. The next question is really quite a complex question. Yeah. How do you calibrate immunosuppressant dosages? Do these change over time? Are they different for different organ groups? So lots in there. So Dipika, let's unpack this question.
Yeah. So how do you calibrate immunosuppressant doses? So that is something that we do together with the team, and it's called therapeutic drug monitoring. So we look at levels of the drug in your blood, and depending on what medication that you're on, we look at something called a trough level. So that's a level of your medication prior to taking your dose, or we look at a peak level. So that would be certain patients who are on a medication called cyclosporin. We look at a level of the drug 2 hours after you take your morning dose. We have certain targets of level that we are aiming for, depending on your time after transplant. So in the 0 to 3 months after transplant, the target or the level that we're looking for in immune suppressant is very different than later on post-transplant. And the target or level is very different for each patient depending on certain comorbidities that the patient may have. For example, a patient might be at risk of over immune suppression. So certain patients that have different kinds of cancers, we want to make sure that we're not giving you too much immune suppression to wake up or to have the recurrence of that cancer. So your target level would be different than another patient who doesn't have an underlying risk of cancer, say for instance. Do these immune suppressant dosages change over time? Yes. So how I like to explain it to patients is over time, your body stops fighting so hard against the organ, and we try and back down on the target level or doses that we use. And the last part of the question is, are these different for different organ groups, the levels that we use? Yes, 100%. We use, if you're comparing organ groups, lung transplant patients, for instance, are on higher doses or on higher levels of immune suppressants than are, say, a liver transplant recipient. I hope that helps.
It does. Now, is it possible that for any of the groups to ever come off immunosuppressants?
I have seen patients on very little or maybe just one immunosuppressant, which is great, years and years after transplant. Prednisone is one medication that we try to taper down faster than others. I've seen patients off prednisone or maybe just on 5 milligrams a day. And the third group that I had spoken about, the mycophenolate group or azathioprine or Myfortic or Cellcept, I've seen patients off that as well years down the road. Yeah.
Thank you. Now, we talked about the drug coverage in other provinces, and this next question asks about drug coverage in a specific province in Alberta. I'm wondering how, what kind of information might be available to patients about drug coverage in their particular province.
So we could refer you could talk to your coordinator, your listing coordinator, and they could perhaps give you a referral to our medication reimbursement specialist. And we actually have a file on each province and what is required. So we have lots of information. We've done lots of research over the years because we're such a great transplant program and our doors are open for people all over Canada, and we want to make sure that everyone has access. So we do have information and what is required. So being from another province is not a contraindication for getting a transplant.
Thank you. Now, I think we might have already addressed the next question related to medications for living donors, but I'm wondering if you could address this one around pain management and cannabis. Is that an option at the pharmacy? Is that being prescribed?
So cannabis is a hot topic these days. It's not something that we dispense from our pharmacy or that we have inpatient while you're admitted. We don't have a blanket statement that says we don't want you to use cannabis. However, I do believe that we stand behind, we'd rather patients not smoke cannabis because we want to, what's the word I'm looking for? Eliminate or reduce kind of other toxins that you might be getting from smoking. So that's in the actual leaf. And we would support the use of certain oils, oils, CBD versus like a higher component than a THC for pain, or a lot of patients have to use this for nausea or appetite stimulation. So it's not something that we are, that is a contraindication, if that's not vague enough. But no, we don't dispense it while you're in hospital. There are some synthetic, sometimes we have to use a synthetic form of a cannabinoid called nabilone. A lot of patients need to use that for helping with maybe nerve pain or sleep, or it is an option. And we have pain service. So we have an acute pain service that is going to be taking care of you and a transitional pain service. So that's a pain service that you might see as an outpatient that helps you once after you're discharged from hospital and you're going back home, and maybe it's to help you transition to a more stable or chronic pain regimen?
Thank you for that. We will be delving into this topic a little bit more in June. We will have Dr. Hans Clark join us as a speaker as part of this series. And so for those of you who are interested in pain management, please join us in June for that session. Now, we've talked a little bit about financial support available for patients. Again, there's publicly funded programs at the provincial level. There's also private programs that are available through workplace, and there may be additional supports that might be available. Is there anything else that you would add with respect to financial support?
Sure. So we do have access at our Transplant outpatient pharmacy, a few programs that are available. So there's one program called Expedite, and that is a program for patients who are prescribed tacrolimus products, so either Advograph or Prograph, and that kind of program from the pharmaceutical industry helps you with maybe your Trillium deductible. So if you have deductibles on your Trillium drug plan that are contributed from that particular drug, Expedite will pick up that cost. Or if you have a private plan and perhaps your private plan is only 80%, Expedite might pick up the 20% of the drug cost of that particular drug for you. There's different tiers and forms to fill out, and it has to do on your annual income, but that's a financial assistance program available. There's also another financial assistance program, I think it's called Rapisure, and that is for patients similar to Expedite in that it's for patients who are on another immunosuppressant called sirolimus, or Rapamune is the brand name. For liver donors, we do have a financial support program, again, from the drug company that makes, or the blood thinner. You'll go on a blood thinner needle for 5 weeks after liver donation. And for patients who express that they have financial hardship, that assistance program does exist, that they cover the cost of that blood thinner for the 5 weeks that you need to be on it.
Thank you for that. We know that this is, a source of great anxiety for patients. And I think what we're hearing is that there is a team available at UHN Transplant within pharmacy to enable you to navigate all of these various sources of support. And the intent is to ensure that no one is left out, that we're reducing financial barriers to transplant and living donation to the extent possible. And so would strongly encourage you to contact UHN Pharmacy as you're navigating your transplant journey, and I'm sure that the team will be able to assist you. This next question relates to side effects of the medications. Can you talk a little bit about this topic, which is also a very big topic?
Yeah, so will side effects change over time? And do you recommend pushing through a side effect if it's not that bad? Oh, I don't want anyone to be suffering. But yes, over time. So for example, one side effect that I can talk about is that when patients start taking medications, some people have a sensitive stomach. I personally do when I start a new medication, or say if I'm prescribed an antibiotic, you get really kind of upset stomach or a bit nauseous, or would experience diarrhea. There's a certain medication that we prescribe called mycophenolate or Myfortic, and that's a common side effect. And over time, that does get better. So that would be something, if you can tolerate it, yes, I like your term, pushing through it. It does get better, but for some patients, it doesn't get better. So the threshold of time that we would try it out, I think it would be different for each patient, or how bad the side effect is. Sometimes we do have to change a medication, or change perhaps how we dose the medication, because we don't want you to be suffering through that side effect. And yes, will side effects change over time? Yes, there are. Sometimes your body does get used to it, as I mentioned, like your stomach toughens up a little bit. There are sometimes that patients are experiencing a certain side effect and it's not getting better, and we switch that medication off to a different one.
Mhm.
Not
And
to.
what happens if someone is experiencing side effect, or if a family member is concerned about a newly transplanted
Let us
patient?
know.
Who do they, how do they get in touch? Who do they report this to?
Their first contact would be their transplant coordinator, and definitely contact your transplant coordinator. And we do have a pharmacist who works up in the clinic with outpatients, and we can help navigate through this, or maybe work with your prescriber to maybe look at different options of medications, or maybe splitting doses to help you tolerate the medication better. But definitely don't suffer in silence. Let us know. Yeah.
Thank you. And I guess our final question is also a very hot topic, which is all about vaccines. Can you talk a little bit about this topic, including, the COVID vaccine, which is top of mind for many people as well?
I'll see what I can
Mhm.
help with. So upon time of listing, so when you are start the process of wanting to or needing to have a transplant, I think that your vaccination schedule should be up to date. So talk to your listing coordinator about that. If they have, maybe they have a certain checklist for you of vaccines that you should, or a vaccination schedule that you should be up to date with, or maybe you have to catch up with that very quickly prior to receiving your transplant. And then after transplant, we recommend, yes, an annual flu shot for everyone. And we also recommend, there are certain vaccinations that after being immune suppressed or while in immune suppression, you should not be getting. So certain live vaccines. And again, we do have lists of vaccines that are safe for you and not safe for you, and what vaccines you need to be up on. We have forms and documents to refer to. Now, COVID vaccination, I do believe that there is a push to have people that are on the wait list for transplant to have your COVID vaccination prior to getting transplanted. And then if it's time that you haven't got your vaccine, your COVID vaccine, and it's time for transplant, we probably will not give you a COVID vaccine within the first month after transplant, and perhaps in the first 3 months after transplant, depending on what immunosuppression or induction agent that you've been given after transplant. So if you're getting a very potent, depending on your risk of rejection, a potent immune suppression or induction agent, we're going to have to push that COVID vaccination forward a little bit, because your ability to mount an appropriate response or immunity will be stunted with all that immune suppression that we've given you. But we do, again, have a team that's looking at this, and talk to your transplant coordinator to see if it's appropriate for you to get your COVID vaccine now, or wait, or later, your first dose, your second dose. There's so much controversy out there now, but it's definitely something that should be looked at.
Thank you. And a reminder to our viewers that we hosted a three-part series on the COVID vaccine. We addressed a lot of Q&As, and those recordings are available on the center's YouTube channel. So please review those as well. They will provide a lot of information on the COVID-19 vaccine and transplant patients. So we've reached the end of our session. Dipika, is there anything that you didn't have a chance to address, any last words that you'd like to say to our audience regarding transplant pharmacy?
I think what my last kind of final, if there's anything you took away from today, is when you do come in, it's time for when it's time for you guys to come in and have your transplant, please bring with you a list of medications that you're on, bring your glasses to hospital. And what I hope the message I got across was, it would really be great if you got your drug coverage sorted, or steps toward securing drug coverage prior to your transplant admission, because really your transplant admission, we want you to heal, recover. We want your organ to work really well. We want to spend all of our efforts, and we don't want you to be stressing about financial matters at the time of your admission.
Very, very important reminders. I would like to invite our audience to join us for some other upcoming sessions. We have a virtual open house next Wednesday evening, which will start with a discussion of transplant innovation and then an interactive exploration of careers in transplant. So please join us. You can register at givelifeuhn.eventbrite.ca. There you will also find other sessions that we have coming up. You can catch Dipika on our Living Transplant podcast. If you have not started listening to that, I strongly, strongly recommend it to all of you. Here's our contact information. If you've got any questions, please contact us. Thank you very much for joining us. Thank you, Dipika, for sharing your expertise. And